Welcome to Politics Done Right. I am your host, Egberto Willies. This is a progressive program that will take the mystery out of politics. This is the program that will encourage you to make sure government becomes we the people. Whether you are liberal, progressive, conservative, or otherwise, you get to air your point of view. We are an independent media outlet that, unlike mainstream media beholden to corporations, we only owe allegiance to you. Remember, you can also send me a tweet at EGBERTOWILLIES. That is at Egberto Willies. Let us engage. It is Politics Done Right. Well, folks, welcome to one more edition of Politics at Random. Egberto Willies, your host. Thank you so kindly for being a part of the show. We are going to have a great show for you today. Again, well, you know, we have great shows for you every day. Anyway, we are going to have not a good time, but a fruitful time. Welcome aboard, El Señor E2247 from all over. Welcome Paul Fleming from Powder Springs, Georgia. Welcome to AVQ, El Señor Michael Rudden from Brooklyn, New York. Welcome aboard as well. We have in the house Eric Hayes from Kingwood, Atascocita. And as more of you come in, I'll give you your salute. Anyway, folks, welcome. Please remember as well, you can give us a call at 281-823-7747. Again, you can give us a call at 281-823-7747. Our beautiful Yvette Avery Herod likewise is in the house. ¿Cómo estás, mi corazón? Welcome aboard, Yvette Avery Herod. Thank you for being here. Anyway, folks, we got a lot to talk about. We've got a lot to talk about. You know, the Mr. Mangione, as we started with yesterday, got caught. Well, what I did on KPFT this morning is I presented what I would consider a cogent analysis of the media treatment of both the executives from the companies as well versus the individual like Mangione. And I'm going to play that a little bit later after I read some of your stuff. Michael Rudnin says he is sick. Senor Rudnin, what's wrong? Do you have a cold, a cough, COVID, the flu, just achy pains? Positive affirmations to you, my dear brother. We give you our dear positive affirmations. We have Melanie Keelan in the house from Barcelona, Spain. So we're represented on several continents now, officially now. All right, let's see what else we've got now. We have, let's see, United Healthcare has reported over $17.21 billion in profit so far this year through denying the claims of their customers. The murder of their CEO won't change their operating model, just their approach to customer service. But I tell you what else it brings. It brings the conversation out, the reaction that people have had. And I first have to qualify. It's never correct to kill somebody. Unfortunately, some lemonade was made out of that lemon, if I can put it that way, however corny, in that it opened the door for people to vent. And the problem, let me stop for a while first. Let me welcome Maywood from Long Beach, California. It gives people, it brings people to not suffer in silence as they have been suffering in silence. I have a wife with lupus, and she has lupus nephritis and all this kind of stuff, right? And we've been living with lupus now from the time from a little bit after Ashley was born, and my daughter is now in her very early 30s. And we've lived through having to work with insurance companies. We've always had insurance, but we've lived through having to work with them. Ashley has gotten 2 strokes. We've had to live through that. And now that she's over 26, of course, she's had to fight to use the different options. She can't get regular insurance. The only insurance she can get is Medicaid. right? But we look at all the machinations one has to go through for healthcare and to get good healthcare. It is terrible in this country, the richest country in the world. And the reason people are so hoodwinked is because we have a system that lies to people, and then we have a gullible audience that when you have people like myself and others telling some truths about how the system works, their minds are so trastornados that they are initially unwilling to take the education in. But that's why we keep doing what we do, because it is imperative that we get folks smart and realize that, I had a call. I should have cut this piece here, but the last call today on KPFT was a wonderful call from a woman named Huma. And Uma said, "Thank you for covering the insurance companies. Thank you for calling out the health insurance companies. I hope you continue to do that." For which I told her, you know, let me up you one. There should be no for-profit health insurance companies at all. There should be none. And I tell you what, before I get into today's subject with Mr. Luigi Mangione, let me just point out one article that I want to put up for you guys. You haven't yet told me what you got, Brother Rudnin. I want to give some positive affirmations to whatever it is that ails you right now, my brother. You know we're a family. This is a PDR family, the Politics Done Right family, and we look out for one another, whether you're on the left, right, in between, or whatever. I mean, we understand that the right does need some help at this point in our history. But anyhow, first of all, let me bring up the first article, and it has to do with administrative costs. Okay? And let me put that on the screen for you. Huge administrative waste makes clear for profit insurance is actually very bad. So, for all of those who think that somehow private insurance is more efficient than single payer insurance, whether it be a single payer that we get a private, a nonprofit company to do, or by the government. I much prefer the government to do it because the government is much more effective. Uh, this here, last week's murder of United Healthcare CEO Brian Thompson brought to the surface a seething hatred of the nation's for profit insurance system, anger rooted in the industry's profiteering, high costs, and mass care denials. But that response has led some pundits to defend private insurance companies and claim that, in fact, healthcare providers such as hospitals and doctors are real drivers of outlandish U.S. healthcare costs. That's a lie. And it has some truth, but it's basically a lie. In an analysis published Tuesday, Matt Brunig of the People's Policy Project argued that defenders of private insurance are relying on factual misunderstandings and very questionable analysis. And that is, it's reasonable to conclude that for-profit insurance system is actually very bad. From the design perspective, the main problem with our private health insurance system is that it is extremely wasteful, Brunig wrote, estimating based on existing research that excess administrative expenses amount to $528 billion per year, or 1.8% of US gross domestic product. All healthcare systems require administrative, which costs money, but a private multi-payer system requires massively more than other approaches, especially the single-payer system favored by the American left, Brunig observed, emphasizing that excess administrative expenses of both the insurance companies and healthcare providers stem from the multi-payer private health insurance system we have. And I let you read the article, but let me summarize things that should be very, very intuitive to all our listeners. And it goes as follows. If you have a doctor who has to hire staff because she or he's working with 20 insurance companies, and they have to have 50 different plans that they work with. In other words, United Healthcare may have 100 different plans, and that doctor's office may have 1,000 patients, and each of those people can have different plans within the same insurance company, and also have many insurance companies. And what happens then? You have to hire staff to go ahead and analyze what is covered here, what is not covered here, what medication this one allows, what medication this one does not allow. You need staff to go through the supposedly efficiency that these health insurance companies are doing to reduce costs. So they're not really reducing cost. What they're doing is creating, right? What do they have again? Shareholders and executives who get bonuses, right? What they're doing is creating a new infrastructure that costs money. And as Brunick says, $528 billion a year. You know what it costs Medicare to administer Medicare, not Medicare Advantage, just Medicare? Less than 3%. It costs less than 3% to administer Medicare, just traditional Medicare. Okay? Now, if you have those expenses, it's not only the insurance companies that have to hire people to deny you service, or it's not only the insurance companies that have to do all kind of machinations to deny you care. It is also the insurance company forcing hospitals, forcing doctors' offices, forcing labs, forcing all these other companies that are within the healthcare infrastructure to have to hire additional people to go through the procedures that these hundreds of thousands, these hundreds of plans that they support. But it's even deeper than that. Each of these insurance companies have to have their own presidents and their own vice presidents and their own equipment and their own advertising and their own all these things. You know who pays for that? You do. With single payer government insurance, those costs don't exist. All of that is saved. Single payer, government run healthcare, all those costs are paid for. It's not rocket science to understand this. It does not take rocket science to understand that a multi-payer, many insurance companies in healthcare does not create efficiency. It creates a drag, a huge cost, not only on the healthcare industry, meaning the doctors, but on the hospitals and everything else. It increases the cost. And you know how we know? We're living it. Our cost for healthcare is higher than every other industrialized country, not by a little bit, but by a bunch. But worse, our outcomes are much worse than the industrialized countries as well. We die sooner, we are unhealthier. All these things are true. So what I'm saying is don't buy the lies. And notice Eric put a lie in there about the VA, a government run thing. Is that the VA is when the VA is funded, it is much more efficient than any other hospital system. The VA is costs much less. The VA also, again, is much better. But you won't hear that. Everybody tries to find a little problem in the VA and extrapolate that when, if you go to the private sector, it is horrendous in the private sector for healthcare. You know what? I know my daughter's been in hospital, my wife has been in hospital in the private sector, and I don't leave them there alone. When my daughter was in the hospital in DC with her stroke, I moved to DC. I moved to DC to make sure I had 24/7 access to my daughter. When she was in a location that I couldn't be in 24/7, I made sure to be close by because I understand that the private sector doesn't give a damn, and when they fail people. When my wife was in the hospital in the beginning of this year, remember, I lived in the room with her. And my daughter, when I had to come and do the show, my daughter would drive up to the hospital and we would switch. And she would stay in the room and I would be here doing the show, finish up writing my blogs, and we exchange again, and I finish writing my blogs at the hospital. That is inefficiency. Because of our healthcare system, I can't depend on the healthcare system when they're there being responsible for them. I also have to be inefficient because of our lousy healthcare system. People, don't be fooled. Do not be fooled. And in as much as the murder is horrendous, what it does is it opened the door to have a real conversation about the evil that is our healthcare system. We should not have private healthcare insurance, or I should say for profit healthcare insurance, because it is a fraud. It is a fraud made to skim money. Medicare Advantage, as Jay just spoke about, is another fraud. It is nothing but getting $12,000 for everybody that they sign up. And then they try to deny you care after getting $12,000 for every Medicare Advantage person that signs up with private care. Americans need to wise up. We should wise up and not allow the decadence of those executives that Brian Thompson, the person that was sadly murdered, he makes $10 million a year for doing nothing. $10 million a year for doing nothing, for being the executive. Okay? All the people that are ripping you off, all the people that are saying you can't have this made, all the people that are telling you you cannot have a service or a medicine or a procedure, they are all the ones making money for the company. And as they deny you more, the company makes more, and the shareholders profit, and the executive bonuses profit. And that lowly person that's telling you no, that lowly person that's telling you no makes a salary and goes home. The salesperson who sells you Medicare Advantage gets a one-time, I sell you that Medicare Advantage, I got me $2,000. You guys have to understand. And by the way, CSAC, yes, the UK has single payer, and they're trying to move some private sector into it now, and it's starting to go down the drain because of the private entities they're trying to impose on. But guess what? Their health is still better than Americans' healthcare. Still better than American healthcare. Nobody goes bankrupt in the UK because of healthcare. Nobody goes bankrupt in Canada because of healthcare. Nobody goes bankrupt in China, in Taiwan, in France. Nobody does because they have universal healthcare. It is that simple. And anybody that tells you otherwise, and to the audience at large, you will see a lot of lies in our chat because the right wing has been seeding bad information on the network, lies on the network, lies on the blog consistently. But I just ask you one thing, listeners out there: common sense. That's all I ask you. Common sense. If on one hand I have to pay for I have to pay for databases each. If I have 100 insurance companies, and each of those insurance companies have to have their own database charges, their own president of the company, CEO of the company, executives of the company, advertising for the company, and all these other things, against a single payer that has none of those costs. Again, we're just talking insurance right now. We can go into the other parts of the healthcare system. But I am asking you folks that are listening to me, common sense. I'm not asking you to listen to me or listen to the thugs that lie to you on the internet to try to tell you that single payer healthcare is somehow less efficient. I'm just asking you to use common sense. On one hand, if you have all those expenses to pay, executives, databases, fees for whatever building the big skyscraper that your insurance company is in, the printing costs, the telephone costs, all the people you must hire to deny people health care. All of that, those are expenses. Guess what? In the single payer system, none of those expenses exist. So let's just start with insurance. You get rid of that insurance plan. In other words, you get rid of for profit insurance and you have one single payer. All they do, by the way, is pay a bill. But the private sector tries not to pay the bills because the bills they don't pay is profit into the pockets of the few. This is not rocket science, folks. This is just asking you to use your brain, to use your common sense. There are these expenses, and there's a lack of these expenses. Please, folks, don't allow them to hoodwink you as we have decade after decade after decade. It is your money, it's your tax dollars or your insurance dollars. So please, please, it's time for us to wake up. It's time for us to rid ourselves of the con that is for profit health insurance and healthcare. We have to rid ourselves of that scourge. And that's what it is, a scourge. And again, just use your common sense. Don't listen to me. Use your common sense. That's all I ask you. Use your common sense. Every time you see a commercial for Medicare Advantage on TV, that's a private health insurance company using your money to pay for that health insurance. Remember that. Every commercial, and you know commercials on TV are ultra expensive. Every time you saw that commercial for Medicare Advantage, but you know what commercial you never saw? You would never see a traditional Medicare Advantage or a traditional Medicare commercial. And guess why? Because it's one payer. Everybody knows they qualify for Medicare at 65. So they don't have to advertise that. That cost is not there. So imagine if we just got rid of private health insurance companies altogether. Think about it. I mean, and let me tell you what I mean by that. You got, we determine what a basic level of insurance is supposed to be. Determine what's a basic level of care is going to be, and have the government from our tax dollars from our we give 3 point something percent every out of our paycheck on all the money we make on all income, not on certain kinds of incomes, but on regular real workers' income. We pay 3% on Medicare taxes. Okay, instead of giving that tax to those private insurance companies, who, by the way, they never used to insure people over 65 because they said it cost too much. When the government started to do it, then they go ahead and they say, hey, we got a plan for you, government. You just give us that money and we'll manage it for you. They're thieves, they're thugs. So, let's be clear here. Let's go ahead and start from now to promote teaching our own sphere of influence how not to be hoodwinked, how not to be conned by private healthcare. Bridge MCP says, Egberto, NHS like Canada do not waste time for certain tests. While we do every test we can get why? So insurance companies make a buck, period. So we are spoiled. My entire family is there, except immediate family is there. When the last absolute needed it is done, they also do preventative care. Do we? No. And you know, that is so smart what you just said, Bridge. Here's the deal. I don't go to doctors, mostly because I work out, I work hard. I work hard, but I get up every morning at 4 and I do my exercise at 4, and then I am ready to do my program, my first show of the day at 6 a.m. And then I do some more work, and then I do the show at 3. I stay healthy. I take my vitamins, etc. Maybe there's something wrong on the inside. I don't know, but I feel good. I don't go out to no doctor to take tests exactly. So you're right about that. And you know what you find, Bridge? I bet your relatives in Ireland are living longer than your relatives here in the United States that have very expensive health insurance. I can bet you that. I can bet you that. So, folks, don't believe the lies that you would see some of them in the chat about these countries that do not, that actually have true universal health care. There's a lot of lies going along, and a lot of the lies are placed here because why? Uh, that's how they have to do your mind. That's what they have to do with your mind. I don't need your money. Give me your mind, then I get all your money. Remember that. It's so important for us to realize these concepts. Okay, so bottom line is the private insurance company, Bree says, live lots longer, late 90s, and even a few over 100. There you go. There you go. Anyhow, no, I'm not telling anybody to move to Ireland, Hayes. Again, you have I wonder how your mind's wired sometimes. I'm saying let's go ahead and make America better. Let's learn from other countries and make America better. That's what I'm saying. AC Rodriguez says, thanks for the quick fix. It's always better to pay cash for extortion if you're going to get a discount. There you go, brother. There you go. All right. Cash only primary doctors have less than 1% administrative costs. That is very true, Mr. Cisak. But you know what? You try to go to a doctor and pay cash for some of the things when you are really, really sick, and you realize those are simplistic answers that make absolutely no sense. Okay? Healthcare is supposed to be a collective thing in a society. Okay? We're not cave people anymore. All right, folks, let's go ahead and get busy with the first video. I did this morning, and then I cleaned it up about the Mangione. Let's talk about it afterwards. Yesterday, of course, the guy who killed the CEO of United Healthcare got caught. I think he really wanted to get caught because apparently he also had a manifesto. He also had the gun that did the job. He also had the same licenses, etc., that he used. Anybody who didn't want to get caught would have rid themselves of all those things a long time ago. But anyhow,
sounds like a crusader.
Yeah. And, we have to be careful the way we say that, but I'm going to talk about that in the right context. And I really want to start today with the perpetrator of the murder of the United Healthcare guy, Luigi Mangione. To some, he is sort of a representation of what's occurring in healthcare in a lot of ways. And I want to start it this way. Mr. Mangione is a murderer. Mr. Mangione effected premeditated murder. He cased the guy. He waited on that man to be in a position where he could take him out. That's what he did to Brian Thompson, United Health CEO. And the mainstream media would have you throw the angst at this guy. They would have you hate this guy. They will go ahead and condemn all those tweets and social media messages where that guy, people pretty much made fun of. Did he get shot by a bullet, or was that a pre-existing condition? As absurd as that sound, they wanted you to think that those people who had those thoughts about this incident were degenerates. Because here it is, Mr. Luigi Mangione, a valedictorian in his class, an engineer or a computer scientist with a master's. He effected a murder, and the mainstream media just wants you to look at person kills an innocent person who has a family and dies. And for that, Mr. Luigi Mangione is an evil person. He's a killer. He's a murderer. He committed a crime. All of that's true. Why is it that the mainstream media, when the Texas legislature denies care? Why is it that the mainstream media, when the Texas legislature looks at Texans that are dying, hundreds every day, because the Texas legislature did not accept the Medicaid expansion to the Affordable Care Act affects the deaths of many of your fellow Texans. Why is it that the mainstream media doesn't look at it as callous, as killing people? Because they just chose not to. We know the result of that law of not accepting the Medicaid expansion to the Affordable Care Act causes death. It kills not one person with a family, but hundreds of Texans with families. Why is it that we don't have that same angst by the mainstream media when every family that loses a loved one dies unnecessarily because the Texas Republican legislature decided to say no to the Medicaid expansion to the Affordable Care Act that is available right now? If they chose to say yes, it'll cost them less than it costs them now for those who continue to get saved, but they say no. The Republican Texas legislature has caused the death of Texans. They've caused the closure of hospitals. They've caused people who would otherwise have lived in an accident to have to travel over an hour for care because they said no to the Medicaid expansion to the Affordable Care Act. But my brothers and sisters in rural America, they don't know about that. They don't realize that the people they're voting for is killing them. Where is the media? Where are the Democrats going into these areas and telling these people, hey, the murderers are up there in Austin, just like Luigi Mangione is a murderer who killed an innocent man because of healthcare. So are those who are denying you healthcare. Why don't we frame it the way it must be framed? Why don't we do our jobs in the media and frame it the way it should? So that part is government. We have a Texas government, unlike the New York government, unlike the Louisiana government, unlike the California government, unlike the government in Washington, the government in Oregon. They've accepted the Medicaid expansion to the Affordable Care Act to keep their people alive. They are not murdering their people by neglect, murdering their people because of ideology. Why isn't the media framing it the way they frame Luigi Mangione as a murderer for a cause? But let's take it one step further. Why is it that the mainstream media doesn't call up Aetna, doesn't call up Cigna, doesn't call up United Healthcare and say and point to them that the denial of service by algorithms, it's not all done by people, in order to maximize profits, they know how to deny services, deny medicines, deny all these things to their insured. Why is it that the mainstream media doesn't call out all the dead people waiting on approvals, waiting on pre-screening, waiting on all these issues that the private companies, the private insurance companies are saying, let's wait a while? No. Those are hundreds of thousands of deaths that occurred because of that behavior. Not one. Luigi Mangione killed one person, and he should be held accountable for killing that one person. I wrote a paper for Daily Kos several years ago where I said we should be holding politicians for neglect, for involuntary, or for that matter, voluntary manslaughter. Texas Republicans, Congresspeople's representatives should be arrested for, in my opinion, they should be arrested for voluntary manslaughter because, again, the denial of service by our Texas legislature caused death. The CEOs and executives of insurance companies should be held as well for homicide. Again, it's not that knowing not giving the services won't give you death. We know it. So therefore, it's not negligent homicide. It is definitely voluntary manslaughter. We have to realize that words matter. Framing of what's happening matters. It matters how things are framed, because we can make something that is done that is really, really bad. Invading Panama for freedom sounds good, but invading Panama and killing a whole lot of people to get one person who was supplying a need that Americans have is a different story when framed that way. That's just an aside there. As you can see, I still feel that dread of having been invaded and killing many of the fellow people you grew up with. Framing is important, folks. And when we allow the mainstream media, who is paid for by the corporatocracy, by the insurance industry, etc., when we allow them to frame what Luigi Mangione did as different than what Mr. Brian Thompson does or did with respect to denial of services that caused the death of many, we're making Luigi Mangione less evil or more evil than was Brian Thompson. Framing a discussion honestly, framing a discussion the way it really is important if Americans are going to learn to vote their interests. If Americans are going to learn to see things the way they really are. And until we get there, we will continue to have the class warfare that we have. Until we get there, we'll continue to do things in a matter that screws us all. So folks, this one story with Luigi Mangione unaliving Mr. Brian Thompson shouldn't end there. It shouldn't end that some young man, some very smart young man, unalived a CEO. That's not the story, because that CEO indirectly unalived thousands. Who is more evil? Please tell me. Am I wrong? I am absolutely sure that I'm not.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel. And number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.
Yesterday, of course, the guy who killed the CEO of United Healthcare got caught. I think he really wanted to get caught because apparently he also had a manifesto. He also had the gun that did the job. He also had the same licenses, etc., that he used. Anybody who didn't want. Well, sorry, I kind of ran over. Let's go ahead and fix this. Okay, who do I have the honor of speaking with? Hello. Okay. Right, folks, we simply got a little microphone problem, so I had to go to an alternate microphone. The sound is going to be a little bit not as good as this is concerned. But anyway, so I hope you understood what I'm trying to do in that program.
in that video. It turns out that we are all on Mr. Mangione's back, right? Yeah, he did a bad thing. He did a very, very bad thing. He murdered somebody. And that is true. And that is bad. Okay? That is true. And that is bad. But here is the magic, people. When are we going to have a media that goes ahead and talks about, well, guess what? Somebody else is doing a bad thing as well. And that is insurance companies, the health insurance companies. And the health insurance companies are killing a lot more people than the one person Mangione killed. That is what we should be looking at. Now, for some reason, I want to try this one more time. I don't understand why we lost our signal. So I want to pause one quick second here and see if I can get my signal back from the JBL and see if it's true or not that it's simply gone. But it seems like, yeah, it seems like my signal is only going to come from the system. All right. Anyhow, so it looks like I can't take calls right now. And the reason I can't take calls is there's something funky going on with our system here that I'm going to have to work on when I get off the phone today, or get off the show today. Anyhow, let me go back and start reading some of the things that you've said. AC Rodriguez, let me go back up top. Tom Zarnik fact check CSAC. Remember I said there will be a lot of lies that come in here, and I don't think CSAC necessarily is purposefully lying. His sources lie to him a lot. We know that because he's a regular here, and he comes with fantastical information all of the times. What I try to do is make sure that it's fact check, and good for us that we have some good people online that does it very well. We have Mike Zarnik that says government he was repeating what CSEC said, which is government has even higher administrative costs than private insurance companies. But he was fact checked by Tom Zarnik that says, according to most studies, government insurance programs like Medicare typically have significantly lower administrative costs compared to private insurance companies, with Medicare administrative costs usually around 2 to 5%, and that goes for the VA as well, and total expenditures, while private insurance companies can have between 15 to 25%. And if you calculate some other costs, it can be even higher than that 25%. It's just how they record charges. But folks, you don't just have to simply take Tom Zarnik's research as an example. You simply need to use common sense. You can't have all those expenditures, meaning advertising, executive pay, shareholder dividends. You can't have all those expenses that the government doesn't have and somehow say that those costs can be similar. Ask, where would those costs come from? The costs that the profits that the private insurance make is a cost. It's a cost. It's money out of every dollar the for-profit company puts into the pocket of the shareholder. Every dollar the for-profit company puts in the coffers of the executive bonuses and salaries, high salaries. Every dollar that the insurance company pays an advertisement for, a database for, and all these things. Each one of those dollars are dollars not going towards your health care. And guess who doesn't have any of those costs? A single payer system, the government. None of those costs exist. And therefore, all of that can go towards health care. The only reason we have all these costs and that we have private health care insurance and all of that, and we have all these different things like Medicare Advantage and all these different plans. The only reasons for that is to create chaos, because in chaos, the capitalist can make money. They can find all these different ways to skim money. All the complexity in healthcare to pay a bill is placed there so that somebody can rip you off. I want you to think about it. What's the purpose of an insurance company? To pay the bill, to pay what it costs for your healthcare. People say, oh, no. Insurance companies manage risk. Guess what? An insurance company only has to manage risk if it's competing with another insurance company. Otherwise, you have communal collective risk, meaning the risk of the entire American population. And when you look at the risk of the entire population, you say a single payer system simply has to worry about the entire American population. Nobody has to worry about risk. If you're sick, you get health care. We don't talk about risk, but we also, as a country, then have other things that we do. We educate people on eating right. We educate people on keeping their weight down. We educate people on all these other issues, right? But also, you have to realize that in a healthcare system, because if you put capitalism into a healthcare system, and I'm going to get into a little bit of economics right now, and I hope you guys, I hope you guys are able to get this, because this is important. If you have healthcare in a capitalist system, what is required in a capitalist system? Consumption. And how do people make more money? By having more consumption. I want you guys to understand this. In a healthcare system, if it's in a capitalist model, only consumption ensures growth or even steady state. So therefore, if you have a healthcare system in the capitalist market system, what happens is procedures have to be kept to keep you sick, to keep you going to a doctor, to keep you doing all the things that are necessary to make money. However, if it is out of the for-profit system, that's not an issue, because if the system has to expand because the population is sicker, it expands. If it needs to contract because the population is less sick, it contracts. And nobody has to feel a pain where the executive has to go to his shareholders and said, well, business went down. No insurance company, no hospital, no for-profit want to say that they're making less money, that they're not growing. But in the healthcare system in a capitalist market, the only way to grow your market is to steal it from somebody else or to have sick people. These are very basic common sense concepts that are not at all difficult to understand. But we have an industry that is designed to make you dumb. Okay? I repeat, we have an industry that is designed, by design, you must be dumb. Okay? It is that simple. Let me just show you as an example of somebody who doesn't know economics. He says, wrong. It is the amount of profit that keeps the market running. A business can have more profit if it has better way of running service of producing products. Again, there is a limit, sir. Go ahead and do the numbers. Don't just regurgitate BS like you just did. Do the numbers. If I am making $1 million and I say that I want to have a 8% growth, if I'm promising my shareholders an 8% growth every year, there is just so, assuming no inflation, there is just so much growth I can get until I max out. And the only way to increase growth is to have more sick customers. I mean, it's math. And that's why I say they want to keep you dumb. It's simple arithmetic. It's not even complicated differential equations or calculus or anything like that. It is arithmetic. It is arithmetic. You cannot grow in the private sector. You cannot grow in a capitalist system in healthcare without having more sick people. And if you don't get more sick people, you have to get your money by increasing their cost or denying their service in the case of insurance. In the case of hospital, your only thing is to have sick people or increase the cost or stealing sick people from other hospitals who then will go down while you grow. It's basic math. It's basic math. Okay? And the crap about found cheaper way to do rockets, there's no cheaper way to do rockets. Okay? I'm an engineer. You can talk about, well, you can reduce the cost here or there, but you always come down to the baseline: metallurgy, materials, fuel, and whether it is possible to recover what you send up, and whether recovering what you send up is more efficient than letting it fall and burn. These are simple things, okay? These are simple arithmetic things. There's no complexity to it. And no, Brother Grant, you said your jump to an ad hominem reveals the shallowness of your argument. No, there's no shallowness to my argument. Prove my argument wrong, please. Anybody who has the ability, prove the argument wrong. It's math. Okay? It's math. And I would come with a calculator with you to prove everything that I have just said. So please, my dear brothers and sisters, anybody who thinks that they can prove anything that I've just said is erroneous. Put the formula on the screen, because you would absolutely be wrong. Anyway, we're coming close to the end of the program, and I appreciate you being here. To my right wingers who unfortunately have been lied to continuously without the ability, I simply ask you to think math. And I ask you to take a simple piece of paper and do on a yearly basis, if you have a fixed population, and if your population is fixed and there's a certain sickness rate, how can you possibly get more profit in that company over time? It's a simple arithmetic problem. And you'll find out that what I just said is a statement of fact. Just get a paper and pencil, go year 1, year 2, year 3, year 4, and you'll find out exactly what I'm saying. And Mike Cisak, you can do I tell you what, Mike, do the write-up. I'll post it as a blog on my site. Do a write-up to prove me wrong. And I promise you this, I give you my holy promise. Write up to prove me wrong. I will plaster your name on it and say, Mike Cisak has proven me wrong. Here are the numerical calculations that prove it. I want you to do that. Of course, I will answer everything that you put in your blog. So if you are so sure of what you're saying, write a blog, send it to me. I will counter it, and I'll post both of them to the internet and give them maximal throughput. So put your mouth where your fingers are. Do it. I said to do the write-up on healthcare. Medicare is just one portion. Do the write-up on healthcare as I'm asking. I am supporting one healthcare system. Healthcare for all. One pool. Just one pool. Punto y final. All right, folks, look, thank you so kindly for listening to the program. I want to ask you so kindly to please share. That is how we're going to get the truth across. That is, and by the way, don't be mad at Mike Hayes or Cisak or Grant or these guys. These are good people just on the right that get lied to continuously. And after you've been lied to continuously, it actually does something in your mind. I did an experiment by listening to Rush Limbaugh in the olden days for a week, and it really has an effect on you. So I sympathize with my right-wing brothers who've been lied to continuously. And the way to get around the lies is to let them prove to you the crap that they tell you. So I'm saying, guys, write out the formulas that make, and I can prove to you year 1, year 2, year 3, why it's a failure, the capitalist model inside of healthcare system. It is that simple. All right, it is that simple. So ask them to prove their points. They can never do it, but it's okay. I always ask anyway. Anyway, folks, please support the program. How can you support the program? First of all, there is one link that gives you all the different options to support our program, and that is politicsdoneright.com/support. politicsdoneright.com/support. That gives you all the different ways you can support the program. Okay, but one of the things that I'm asking those is we're using our newsletter, Egberto Off the Record newsletter. And take a look at it. You can take a look at Egberto Off the newsletter at egberto.substack.com. Let me put that in the link. Here's where my newsletter is at right there. Okay, that is the newsletter, and that newsletter comes to you by email, etc. And it has sections there that are actually what's the word that I like to use, that are protected. You know, anybody who become a subscriber, a paid subscriber, get access to read all of my books. And if you're looking at the screen right now, I'm scrolling through all of my books. Okay, now if you become a paid subscriber, all 5 of my current books you get to read on the Substack platform. And as I write more books, all those books will be free to you to read. Anybody who become members, who become paid subscribers at politicsdoneright.com/newsletter. So please become a paid subscriber at politicsdoneright.com/newsletter. And you don't only get additional information for most of my blogs, because my blogs have a free section and a section for those who are subscribers, again, to kind of help us build this network. We need about 2,500 subscribers. We're only at about 10% of that. Okay, I'm hoping that within a year we can get to build up to that full figure. Again, if you want to see truth, if you want to be able to see all these things that we talk about, support us. We have to get to most Americans. We're not going to convince guys like Eric Hayes and Mike Cisak, but they will give us material to help teach other people. But these guys are set in their ways, and reality doesn't matter to them. They just believe in their ideological slant, nothing else, nothing more. But that's fine. I still love them. I still want them here. But we are tasked with just telling the truth. The problem is the right has a whole lot of money. The right has a whole lot of money to invest in lying to these people. We don't have a lot in telling the truth, but that's where you come in. We are not only book writers, and we don't only write a whole lot of content. We make sure to go out there in the field to inform. An educated population make the right choices. An uneducated population can fall for the right-wing fascist crap. That's why we are here. So I ask you so kindly to go ahead and go to politicsdoneright.com/newsletter, politicsdoneright.com/newsletter, and become a paid subscriber. And with that, you get the books. We're going to start doing some live shows on the Substack platform, as well as live chats, etc. Again, we're setting that up right now with Substack. I still have some technical support things that I'm doing with them. So there's a whole lot of new things that we're going to be doing next year. So start joining, become a member. politicsdoneright.com/newsletter. So it's cheap. Become a paid subscriber, and we'll take it from there. Anyway, I got to get out of here. My name is Egberto Willies. This is Politics Done Right, and you guys know how I end this baby. I am what? Out.
Welcome to Politics Done Right. I am your host, Egberto Willies. This is a progressive program that will take the mystery out of politics. This is the program that will encourage you to make sure government becomes we the people.
Whether you are liberal, progressive, conservative, or otherwise, you get to air your point of view. We are an independent media outlet that, unlike mainstream media beholden to corporations, we only owe allegiance to you. Remember, you can also send me a tweet at EGBERTOWILLIES. That is at Egberto Willies. Let us engage. It is politics done right.